According to the CDC, deaths from prescription painkillers have reached epidemic levels in the past decade. Nearly 3 out of 4 prescription drug overdoses are caused by prescription painkillers. Many people first get exposed to these potentially dangerous medications in the hospital after surgery. Dr. Redan authored a new study about this. He's at the American College of Surgeons annual meeting in San Francisco today. Good morning, doctor.
Good morning.
What are some of the side effects of post-op narcotic drugs?
Well, as you mentioned, a very concerning side effect is the addiction potential. So if we can prevent utilizing these medicines right at the time of surgery, as you mentioned, we can reduce that 2 times risk of patients becoming addicted because of really what they're expected as their normal post-operative care. We need to change that.
Do patients have safer, in essence, better alternatives?
Absolutely, and that's what really is the purpose of being here, is to inform docs, specifically surgeons, that we can help reduce this problem of drug addiction, other side effects like respiratory trouble breathing. People can get woozy and have a fall risk. So what we did at the meeting is compared our traditional narcotic use of medicine versus these new narcotic alternatives such as Exparel, where we inject the surgical site at the time of the procedure, and therefore patients will utilize less narcotics and therefore have less risk of the complications associated with these drugs like the fall risk, respiratory depression or trouble breathing, nausea, vomiting are 2 of the other things that we can reduce after the time of surgery.
So there at the meeting, what are you hearing from surgeons? How are they receiving your message?
Well, I think all docs know that narcotic use is a major problem. And they're very excited now that they have an alternative to offer patients, and we want to make sure they use it properly and inform their patients. And actually, we're finding now a lot of patients are informing the docs, which is obviously a great thing with the internet, where they get Google information and develop a comprehensive treatment plan so they don't have the fear of pain after surgery.
Let's do that. Let's speak directly to our viewers who are currently scheduled for surgery. What do you recommend to them?
Well, I think they need to talk to the doc, and I think a lot of patients don't bring this up with their surgeon. You know, they know they're going to have an operation and they're afraid of having pain. So if they discuss this treatment plan with using non-narcotic alternatives, injecting the surgical site right at the time of surgery so they can treat the pain right at the cause, they're going to have a much smoother, faster, better recovery, and they won't have all the side effects that they're afraid of with narcotics.
And it's just as effective in terms of comfort for the patient?
Absolutely, when injected properly, and there is some training that we always want to make sure that docs have, is that once they understand how to use this medicine properly, it is fantastic as far as pain relief for days after surgery.
You mentioned jumping online and learning more. Is there one site where you'd send our viewers?
Yes, there is Exparel.com. I think it's a great website. It's lots of good information. I'd print it out, put it on your iPad, bring it to the doc with you when you're going over your plan, and I think that would be a great way to start.
Well, we are all encouraged as patients to be our own best advocates. This might be a good example of why that's important. Dr. Redan, thanks for joining us.
You're welcome. Thanks so much.
And